Bear with me. Okay, thank you. So welcome everyone for joining us to the UK Public Sector Tableau User Group. So it's been a little while since we've done one of these. I think this is the first one that we've done this year. We had got a load of plans in place to put one together in March, but then obviously COVID happened and things had to be put on the back burner while we tried to deal with what we were having to deal with at the time. So I just wanted to give a quick introduction to the team who runs this user group. So it's quite a small team. It's currently made up of myself, and I definitely don't look like that anymore. Lockdown hasn't been good to me. So it's made up of myself. I'm James Goodall. I'm the Analytics Support Specialist who's working at Surrey County Council. And the other guy who I run this with is Mike Henry. Mike is the Head of Intelligence at Kirklees Council. We were put in contact with each other at the beginning of last year, I think. So it feels like a lot longer than that ago now. But yeah, and we've managed to do a few of these events, mostly virtual, with one physical event up in Birmingham last year where we looked at the index of multiple deprivation data. But yeah, so this is now the kind of the dust. I say the dust is settling. It looks like the dust is picking up again now. But now that the dust has settled a bit from earlier it was this year, we're hoping to get some of more of these in the calendar, and so we should see a little bit more regularity with these. So in terms of what we've got for you today, so we've got some great speakers. Starting off, we're going to have Abigail Webster, who works at Hackney Council, to talk through some of the public-facing dashboards that they built to try and combat COVID. So this is going to be the theme for all of our presentations today. It's looking at how organisations in the public sector have responded to COVID-19 using Tableau or other tools to try and help their response. So after Abigail, then we've got Farhad, Hossen and Sonu Mittal from NHS England and Improvement, and they'll be talking through some of the analytical tools and solutions that they put together, again, as part of their response. And then finally, you're back with me, and I'll be talking to you about one of the projects that we ran here in Surrey around the tactical surveillance. So just a little bit of admin for the session. We'll be having some questions after each of the presenters. So there's a chat box, but there's also a Q&A box. And so we'd ask if you have any questions while anyone's speaking, if you could pop them in the Q&A box. Then we'll pick them up at the end of each presentation and go through that little Q&A session with the presenter. If you've got any more generic questions, then we'll probably try and deal with those at the end. But do feel free to keep on dropping them in the box throughout the entire session. So yeah, let's get on with it. So as I say, the first speaker that we've got is Abigail Webster, and so I'm just going to stop sharing my screen. And invite Abigail up to the stage. Abigail, hiya.
Hiya. Hello, everyone. As James says, I'm Abby Webster. I am a senior public health analyst in the London Borough of Hackney's Public Health Intelligence team, and have been asked to come along today and give a quick overview of how we, within the Public Health Intelligence team, have created some publicly available dashboards on the COVID-19 situation. And that's both for within Hackney and the City of London, which we're also responsible for, and for the whole of London using Tableau. And before being tasked with this, I had never really set eyes upon Tableau, but I personally think like the first step towards getting a grip of Tableau is to understand what it can do and the links between the different Tableau platforms. So in this little tutorial, I'm going to be working with Tableau Prep, Tableau Desktop and Tableau Public to give you a bit of a taster. So within the London Borough of Hackney, we work with G Suite, so most of our data is saved on Google Sheets. And while as far as I know, Tableau doesn't really have the capacity to work with shared drives in Google Suite, you can read directly from individual Google Drives. So within G Suite, you can share data sets that are saved on your personal drive with colleagues, and then they can edit these and then you can upload it to Tableau, vice versa. And that's what we tend to do. If I quickly share my screen, you can see this is all the data that I use for the public dashboard that we have. and it's saved in its raw format in one Google Sheet on a number of separate tabs. And I've set up this overview tab, which just shows all the data that we've got, a description of what the data sources are, how often the data gets updated, when we last updated it, what data was available at that point. And that allows us to keep on top of what's been refreshed and avoid duplication of work. Each tab then contains raw data from each source, which is formatted within Tableau Prep. The data I'm using here is from a number of sources. We've got Public Health England, gov.uk, and they're both for cases on COVID-19. And then we use NHS digital data for testing rates, as well as Office National Statistics data on COVID-19 deaths. So this is a screenshot of the prep step that we've got. It's really limited compared to other dashboards we've set up because there isn't actually that much cleaning that's needed for analysis. Only 2 of the data sets that I'm using here, so ONS data set on deaths and the gov.uk data we have on cases, they're the only ones that need cleaning. The others can head straight into Tableau because they're already quite clean in their raw format. But for the ONS data, we read it in and remove the variables that we don't want, and then we pivot it so that we can calculate the number of other deaths from the data that's available. Because the deaths data is split into COVID-19 cases, COVID-19 deaths and all deaths, so we have to create a calculated field to figure out how many other deaths there were. And then we name this new field other causes, and I can join the data with a lookup that we've created, which looks at the week number. ONS data itself comes with week number, and then we need to see what dates that refers to. And then the other data set that we need to prep is Borough cases, because when I read this into Tableau desktop, I want to join it with a shapefile for mapping. But that shapefile that we've got has slightly different naming conventions. So within Tableau Prep, the only changes I need to make are to borough names. For example, we've got boroughs like Richmond upon Thames need to be changed to Richmond, or Kingston upon Thames to Kingston. And then once I've outputted it, I can link it to the shapefile within Tableau desktop. I'll quickly share the Tableau desktop tab with you. So we have four dashboards that I've created using all of this data. And it's actually an old version that I'm showing you, which is why some of the data is outdated. But later on in the presentation, I'll show you a newer version. But yes, here I have 4 dashboards. We've got COVID-19 cases by week and the R value for London. We've got COVID-19 cases by borough, and this chart shows you the fortnightly cases by borough, and it gives it a ranking. So as you can see, Hackney and the city at this point was high. I think now it's maybe 3rd, which still isn't great. But also we have a map showing all of the cumulative cases by borough. We also have COVID-19 cases by age. We've got a population pyramid, which is ordered the wrong way around at the moment, and an age bar chart. And then we've got COVID-19 deaths. So all really interesting stuff. I'll quickly show you how I made one of these graphs, just to show you how easy it is. I've created this calculated field, which calculates weeks backwards from the greatest. So when we upload the data in, we need to calculate complete weeks. So I created a new week calculation so that the last week of data is a full week. If I change this though to a different type. Oh, it's the wrong one, sorry. I need to put in week ending. There we go. So I'll change this to one of these. And then if I place in city cases here and Hackney cases here, change the type to bar, and then to move this to this, get rid of measure names. You've got this this bar chart like I showed you on the cases dashboard. And yeah, it's just really easy to build. You can hover over it and you can see the values, and then within the tooltips you can change what the tooltip says and what other values you want to be included. So for example, I might put in instance rate, or I might suppress some data that is too small that you wouldn't really want to show. So once we've done this, we upload it to Tableau public, and from there we have links within our Hackney Council pages, which embeds the code to the Tableau public page, and then it reads in directly. It's really linked, so as soon as I've updated everything in the desktop, it reads through to public, and then straight from public to our coronavirus page. I'll show you this page now, and this is using much more up-to-date data. So you can see that the dashboards are more up-to-date and have been slightly altered to what I was just showing you. Tableau allows quite an iterative process where you can change the dashboards, and suggestions come through as suggestions come through, and we want to highlight changing trends. So we have here a slightly updated cases chart, which shows instance rate R value and whether cases instance and R values increasing or decreasing. Then we have cases by age. That's very similar. This is ordered the right way around now. We've also plotted cases by ward within Hackney, so instance rates, and you can also see in the tooltip total cases and weekly cases. And then we have a bit of a description to the side of it. And these are great as well because you can just go between weeks and see how things change. Again, we've got cases by borough and then deaths. And it's just really helpful to have these because not only does it mean that colleagues at the council and our residents have access to timely data on the coronavirus situation as it unfolds, but it also really eases some pressure on our team as we can direct users straight to the page and spend less time replying to ad hoc emails. And all the graphics always go down really well. They're really appreciated by the mayor and by other councils. And with that time being freed up, it means we can direct resources to other bits of analysis, both COVID and non-COVID related, and develop our internal Tableau dashboards. So this is the public one that I've shown you, but we've also got a dashboard on our test and trace work, on our care homes and other situations. And it's just great for internal work as well, because they are on Tableau online and scheduled to refresh as soon as the data becomes available. So yeah, hopefully this has given you a good overview of how Tableau can be used within your area, or some confidence that it's not as hard as it looks. I will leave my contact details somewhere in case you want to ask me any questions, but I also think we have some time here.
Thanks a lot, Abigail. That was really interesting. I don't think we've got anybody putting any questions, but I've got a particular question. I suppose with you being new to Tableau and I suppose having experience now of using Tableau Desktop, Tableau Prep, how did you find that in terms of a learning curve, particularly getting around to kind of building the individual visualizations and then actually putting that together as a dashboard?
It was harder at first, but I think the more you learn, the easier it becomes, and the more accustomed to Tableau, the easier. And that's why these user groups are good, because it gives you an idea of what can be done with Tableau. There's lots of resources online, but we also had some contact information of people working in Tableau so that we could ask questions. But yeah, when I first started up, it was easier. Once the data's in and processed, it's so easy to make the visualizations, and then they've also got the panel at the side that shows what Tableau think you can do with it, which is great. Yeah, I think it took about 2 weeks of wrangling until I sort of got my head around it, and now I'm working on all the calculated field stuff, and that's really interesting what you can do with that.
yeah, it really kind of brings the power home, doesn't it, of the tool as you're kind of exploring it. I think we've got a question from Kim about whether you could, I don't know how easy or difficult this would be, Abigail, explain a bit more detail about creating population pyramids in Tableau.
Yeah, sure. I might be able to show you. Let me go back to the Tableau page. It's actually much easier than I thought it was going to be when I first did it. So if I go onto it now, this is obviously ordered the wrong way around, this one. You basically just need to create two so the way this data was structured is that we've got all our cases, and then each case has a gender. So I've created a calculated field from that, which says that if the patient's gender equals male, then show COVID-19 cases, otherwise null, and that gives you a male variable, and then you just do the opposite for females. And then you just need to place these on your columns, and then your age group on your rows. For a population pyramid, you need to sort it the other way around though, so I'll do that now. That's what it should look like. And also, once you first plot it, the females will be formatted like a normal graph, so going from left to right. But if you go on your axis, you're able to change the direction of it. How do you do it? Yeah, you can edit whether it's reversed or not. So if I unclick reverse, you see how it just looks like two bar graphs. I'll go back on it, click reverse, and then you need to make sure that the scales of the males and the females graphs are the same so that you can compare between. But yeah, that's about it. And then you can hover over and it will show you age group by male and female.
Brilliant, thank you very much. And thank you for the presentation, Abby. It was really, really interesting to see what you've done, particularly picking it up from scratch during the pandemic and developing that stuff. And yeah, similar to what we've done in our local authority, it's been invaluable putting that public information out in terms of, I suppose, the responses from the public, but also inquiries from other partners and stuff like that. So thank you very much. Okay, so next up we have Farhad and Sonu, if Sonu's here, who'll be talking about the work they've done at NHS England and improvement during COVID-19. So over to you, Farhad.
Sure, thank you. Let me share my screen first. That would be... Also share my video. Hope you can see me. So Sonu cannot make it. She sent an apology. We got a live dashboard and some metric changes happened. So she's currently working on that to fix it along with the team. So she sent an apology. So I will be running the show for the next 20 minutes. So what we are planning to talk about today is the analytical products journey during this COVID-19 in NHS England and improvements. So that's the briefly, I'll just touch on what are the product and what are the things we have done in this last 3 or 4 months in the COVID-19 period. So first, a brief introduction about the team and myself. First, I'm Farhad Hossen. I'm Senior Analytics Product Lead in the NHS England and Improvements. We are team called Analytical Products. We're under Improvement and Product Services. So as my team is responsible for developing analytical products and which is based on Tableau, mostly visualizations and the processing of the data. We use SQL, Alteryx, R, Python. And we also have got our new Foundry platform where we can do the data ingestions and processing the data there as well. So bringing the data back to Tableau. So as a team, we have got a number of analysts, data engineers, product developer, business analysts, tester, and product managers. And as I briefly mentioned, so these are the key roles the team play. And it's apologies from Sonu. So she's a senior analytics product development manager in the team. So today's agenda, I'm not going to probably deep dive into the dashboard the ways Abby has done. So I'll just show you some of the slides from the from our dashboard. So what are the challenges we have faced, and how many products we have releases in last few months in the COVID time, and then what are the uptakes and the outcomes from those. So the challenges we had, like, because this is new, this data never exists before, and this is a new data set, so we need to provide an analytics to the regional national team and provide an CCG so they can use this analysis or visualization to make the decisions. And to our responsibility is make sure we get the data, right structure, and do the engagement with the users and make the visualization in a way so that people can use it in the right way. So, and the data quality is also one of the key things. We cannot, if we put something wrong, that will come up probably immediately media attention, and that's really will go in the other way around. So these are the challenges we had. I think main challenge I would probably say is the developing in short durations, because of number of things you have to develop. We have to park our regular product development for at least 2 to 3 months. So what we did, we collected data from the hospital settings as well as the primary care GP practices on a daily basis. We collected demand-related metrics, capacity metrics, confirmed cases, new admissions, bed occupied, and you can see quite a long list of metrics we have collected from various settings, and then we developed the products based on those. So the next slide is I'm going to just show you a few dashboard list. So you can see, so first dashboard, this is all COVID related. So first dashboard we have released on 9th of March, which was like we call it our main COVID operational dashboard. And after that, we continuously releasing the product, which is the data we collect, we populate some analysis and build a dashboard and release to the sector so people can use those. So you can see quite a big list of products that we have released. So this is we call it our hub, which is the landing page for all COVID related dashboards. So that they don't need to go to our normal landing page. User come to here and they can see the COVID related dashboards and they can access those dashboards. So in here, it shows a name of the dashboard and the brief descriptions. And also it says, what is the permissions levels we have? So for example, some dashboard is the regional level security, some has got the provider level security. Because the data we have, these are unvalidated data, which is just we are getting the everyday data, which is as of yesterday is up to date. So we have to make sure the security is really tightened so the regional team can see their regional trust or their regional GP practices, for example, same way. And if provider login, the provider can see the regional data for certain products. Certain products, they can see only the provider data only. So we then applied those security in Tableau data source level, so that it's even the people access the data source, they will not be able to see the details or other provider data. So anyway, so people can access the data, the dashboard from here, and depending on that access level. So the next slide, I'm going to just show you a few of snap from our dashboard. So this is the COVID-19 main, we call it main operational dashboards, which is basically including all the metrics that I mentioned earlier, and it shows the headline number on the top, and then it also shows the time series. On all the COVID-related dashboard, what we have done, every dashboard has got the key headline numbers on the top, and one of the reasons for that is the regional and national team, the support team, they put this dashboard into their big screen. So for them, they just need the key numbers, what's happening, how many new cases happened, or how many bed is occupied by COVID patients, for example. So they can see those headline numbers. So that's why you can see has got the headline number on the top, and they can also see the trend. Obviously, we all are expecting trend to be down especially for this kind of data set. And they can also see the trend on that data. So this is workforce analysis. We're also collecting in the same collection. So it's basically showing the workforce, how is COVID-related absence or sickness. This is only sickness data, how COVID-related sickness we have or overall sickness we have, so they can compare the data here here. So you can see the same charts in here and here. The difference is this is come from the collections that we are doing specific for COVID collections, we call it, electronic collection from the hospitals. And this is from the ESR collections. Although there is some number difference is because of this is from ESR and this is the trust submit on that day. So there might be some discrepancy on there. But if you look at the COVID related absence, they're pretty much similar, but overall absence in the hospital or nationally, it has got some big differences. So that's something also can be investigated from the side. Why do we have got two different sets of numbers from the trust? So one is coming from ESR directly and one is coming from the electronic collections that we're getting. So this is, and also we are not only doing for hospital support, for example, doing acute and community health sector. We're also supporting health and justice, like all the immigration detention center and prison centers, how they are coping with these COVID related situations, like how many staff or patients are isolated, how they are in next 7 days, what is their capacity in a regional level or any service provider levels. They can drill down to that and they can make a decision based on that. They also get a notification alert levels. If they are going down to their PPE is down or their staff is down, they get a notification from there. We also got the mortality dashboard, which shows the last 24 hours COVID positive patients, how many patients have died, unfortunately, and then total, how many patients died. So these are like top level numbers, and they can also drill down to the regional level and CCG levels, and they can see how this is moving for every day, for example, for death. This is the old slides and showing the when April and May times when we had very COVID patients was really infection was high. So the next is prediction modeling or forecasting data. So we are not only looked at what actually happened, but also try to investigate what might happen and where, using the predictive power, using our platform like Foundry platform, which has really enabled us to do a lot of advanced analytics or doing forecasting modeling there to locate the next hotspots, where the hotspots is in the country and where the resource needs to be redeployed to do that. So part of that, we developed this dashboard, actual forecasting modeling done in the Foundry platform, as I said, and then we brought the data back to our data warehouse, and then we developed this dashboard. It's basically showing in here so this is by, you can have any level, regional level or STP level or trust level. So for example, it shows currently the regional level, and then it has got the list of calls like 111, 999. I'm not sure that you can see, and then online. And so the model is basically taking the NHS 111 data, test data, and the COVID collections data. And they're saying, okay, this is 111 data is 4. Is a 1 to 4 is a ranking. 1 is the more higher risk or need a more resource to manage, and 7 is for less risk in that sense. So is putting the number in that scenario. And they're also doing in a forecasting modeling. So for example, we are saying how many beds will be needed for next 7 days or 21 days. Sorry, 7 days we're doing for 7 days. How many emergency admission we're expecting in next 7 days. You can filter down to the regional level STP or even trust level. So this is really helpful for user or trust level or regional planning perspective. They can see, okay, what number of COVID cases we're expecting in next 7 days. And actual model we develop here, this is using the Bayesian hierarchical model. If anyone interested, this also includes the NHS 111 and the test data when you develop this model. This is also done in the Foundry platform. The faculty team, they have done the main modeling work. We, as a team, analytics product team, we got the data and we just visualize that in Tableau so that people can access it. The next one is the primary care dashboards. I'm just showing you various slides, so I'm going to be very quick. So this is, like as I mentioned, the primary care related metrics, like how many appointments, GP appointments you had, what kind of appointments you had, is it online face or video consultants, face-to-face, and see their trends, is it going up or going down, and the test and the pharmacy data. So combining all these data in one. So this is in a primary care related. So it's used by primary care team, and their day-to-day decision makings, they use this dashboard. So next one is the medicine dashboard. This is one of the dashboard Tableau team help us to build these dashboards. We closely work with Tableau and our medicine team. So what this dashboard is basically showing that what kind of, this is not all the medicines, this is only medicine that has been used to treat the COVID patients. Although we know there is no medicine for COVID, but these are the medicine have been used in the hospital settings to treat the COVID related patients. So what you can see the stock and uses of the medicine in the hospitals, and you can look at by individual product, or you can do a group of products and then see what is the stock level in the hospital settings. So these are like a list of dashboards. So, and the next one I just want to show, this is like how our building a dashboards and how things actually user is growing in our environments in a Tableau server. So you can see there is like a distinct 7,000 users are currently accessing our dashboards, and 300,000 page views. So which is really, people are really engaging to these our product, and people are using it, which is our satisfaction in that sense. What we have produced is useful and people are accessing it. And most of in here, we just wanted to see, okay, what time of the day most our dashboard has been used. So looking at here, it's basically used at 1 p.m. And reason is that because most of the collection submission time is at 1 p.m. So on that time, people are hungry to see the data, what's happening in the sector. And you can see there is a heavy usage one in March and April, but then it's gone down and is picking up now. But this slide is a little older, so I don't have the latest figure here. But this is now picking up now. People are more accessing the dashboard than a few weeks ago or a couple of months ago, shall I say. This is the same slide. So overall, what we have done, so we have improved the data quality, bringing the data from various places. We analyzed the data, presented the data in an advanced way, and visualized in a various dashboards, which helps national and regional team to make the decisions while is pandemic happening. So this is really, as a team perspective, I would say is really key achievements, and that we, in a very short notice, short period of time, we have developed a number of products which are heavily used and in the sector. So I would just want to probably say thank you to the team, and they all have done our hard work. So team, it's not like we only work ourselves, we also closely work with Mastech, Interworks, and Tableau. These are like our external consultants, so we closely work with them. So their support is also appreciated. So we are closely working with them to bringing all these product and dashboards. So yeah, I guess that's it from me. So open to question, really.
Thanks, Farhad. Some brilliant work there. Some of those kind of take-up numbers and adoption rates are absolutely fantastic. And I recognise some of those dashboard layouts from our local work that we've been doing around COVID as well. That's quite a comprehensive set of products, I suppose, to develop in a relatively short period of time. What would you say is the biggest challenge in producing such a comprehensive suite of products and making them accessible to such a wide range of users?
Our policies, first of all, is a team dedication. So I think they are, as a team, we want to make that dashboard or product out so people can use it. And this is a COVID-19. So this is, we feel like this is our contribution to the NHS. And in terms of technology, I think Tableau really helped us to build this kind of dashboard or product so quickly. As a team, sometimes people call us like a Tableau team. So we use Tableau like every day. I'm using Tableau since 2016. So so I think it's people's skills in Tableau, and as well as great support from Tableau team, Tableau itself, and Interworks and Mastech consultants. These guys are also very expert on these tools and technologies, so they have helped us to build these kind of things so quickly.
Thanks, Farhad. We've got a couple of questions in. John asks whether you've got a way of prompting people to alert them when the dashboards have been updated, or are users just getting familiar with the kind of time of day the data's updated, and yeah, accessing things without any prompt?
We do send the Tableau provide itself is you can subscribe for it. So as a user, you can subscribe and you can get a notifications. But currently, we're not sending any notification to the users. I think sometimes if you send an email, it just go to the junk or somewhere. They don't normally bother. We do mention on the dashboard. So if I probably show on the dashboard, for example, in here, you can normally show when last updated, what day of the time it's last refreshed. So you can see the data. So each dashboard has got the last refresh time on the dashboards. No, we currently not sending any notifications.
Brilliant. And we have a question from Dipesh who asks, the visualization you had around the engagement numbers in terms of access, is that one chart or is that multiple charts that you've kind of put together on a dashboard?
On the slide, we put a one charts, but there is various charts, and there's like a specific dashboard we have for looking at these numbers. Yeah,
that's brilliant. Well, thank you very much, Farhad. That was really, really interesting. And yeah, thank you for coming along today and sharing that with everybody.
No problem.
Thank you very much. Which brings me on to our final speaker of the day, our very own James. So James, do you want to kind of share your screen and talk about the work you've done in Surrey in response to COVID?
Absolutely. Thank you, Mike, and thank you, Farhad and Abby, for your presentations. Really interesting stuff. Okay, so let's share my screen. Go. Okay, so I'm not going to do any more introductions because I've already introduced myself today. So I'm just give you a brief overview of what I'm planning to talk about today. So with time allowing, I'm going to split my presentation into two parts. I'm going to talk to you a little bit about one of the particular COVID-related projects that I was involved in here in Surrey. And then for the second half, as I say, if I've got time, then I'll try and do a live dashboard build of one of those dashboards that we use to try and give you some tips and tricks in using Tableau. So to begin with, the project that I'm going to talk to you about is for the tactical surveillance cell. So we had various projects that were set up in response to the snowballing COVID crisis. You know, things looking after shielded people, for instance, we've got Untitled Test and Trace project. But kind of this one that I'm talking about is just the surveillance cell. It's the one that gives an overview of the state of COVID in various different settings with different flavors and kind of helps people in their planning around this. So just to begin with, I'll just quickly mention who was involved in this project. So obviously there was myself in the data analytics team. We worked closely with our public health team, our insight analytics and intelligence team. We also had to work with external partners outside of Surrey, so people like Surrey Police, our NHS partners in the CCGs, as well as the Register's Office to collect information around deaths, that kind of thing. And the reason we're kind of involved in all of these, I mean, I'm sure I don't need to tell a lot of the people in this group. Obviously, our public health teams have a responsibility to look after the public health of residents. And one of those factors is obviously preventing or helping to prevent the spread of communicable diseases. So we kind of needed to build up some collaborative approaches to involve people from various different teams within the authority, as well as external to the authority, to try and answer some questions. And so to do this, we needed some data, and we needed some up-to-date data, and we needed it quickly. So what did we need to do in order to access that data? Well, we needed to figure out what data sources we needed, obviously, and we needed to, wherever possible, automate the collection of that data. What we couldn't have, you know, this is an ever-changing crisis. The needs, the requirements, everything was evolving so rapidly. What we couldn't have was people sitting around copying and pasting data out of spreadsheets, out of Word documents, and pasting them into a master document. That's not analysis, that's just boring, repetitive data preparation. So wherever possible, we needed to try and build in a process to automate that. And resulting from that, we then had to produce a suite of dashboards. Obviously, we're a Tableau centered authority. Tableau is our corporate dashboarding tool. So the plan was to deliver a suite of dashboards that would give that, like I said earlier, that overview of the state of COVID within the authority, and to use as a tool to help us as well as our partners target resources where they were needed. It being a dashboard, obviously, I don't think it needs to be said that the designs needed to be easy to understand, but at the same level, obviously, the amount of data sitting behind it, or the levels of the significance of the decisions being made, we needed to be able to communicate enough information to help make those decisions. And one of the challenges that we had at that time was that our partners didn't actually have access to our internal Tableau server. So we needed to put some thought into the interactive elements, like how could we communicate this information without necessarily people being able to drill all the way down into the data. So I think it's worth a moment just to talk about the actual data. Now we've heard about some of the data sources already from Abby and Farhad, and so we're kind of putting together a list of things that we would need to try and help address that response. Obviously, we need things like number of cases. We'd want numbers of tests eventually. We'd want the rates in the population, possibly linked crime factors. We'd want where people were dying. Were they in care homes? Were they in other community settings? Were they in hospitals? We'd want information around vulnerable people so we can help inform that Shielded People project. We need to know where within those hospital settings people are dying. What are the trusts that need additional resource putting towards them? And are there any particular type of institutions where we're seeing these outbreaks? And so to begin with, all the way back in March, do you think we had all of these data sources? No, we didn't. At the very beginning, we had information from Public Health England that was, now I've put on the slide there down to region, upper tier local authority and lower tier local authority. At the beginning, we didn't even have lower tier local authority. So obviously there was information being put out by Johns Hopkins University in America at the time, which gave a national level. That didn't really help us in our local planning. But so Public Health England started putting out this information which drilled down to UTLA level, the upper tier local authority. But that itself wasn't without its challenges, should we say. And I think that kind of brings me neatly on to talk about some more of the challenges that we encountered during this process. So, as I say, right in the beginning, we were looking at number of cases. That was actually spread across four different data sources, structured in a different way, giving a slightly different flavour of the data. The data that we were picking up from these organisations would regularly change structure. That, columns might be added or taken away, or they might be pivoted around a slightly different way. The items within those data, within those pieces of data would change. Something as innocuous as changing, let's say, upper tier local authority to an acronym of UTLA or vice versa. Now, if we had any logic that was being based on the values, on those values, or any filters in Tableau, for example, then we'd have to rebuild it, rework it to try and account for those. As well as all of those kind of changes to the data, there was changes on how the data was being hosted. I mentioned Public Health England were hosting that data originally. For a period then, they just took it down and replaced it with that coronavirus dashboard, which they didn't give a link to the data that was sitting behind, although with a bit of reverse engineering, you could find a JSON, but then the title of that JSON would change every single time the data was published. So it was kind of trying to anticipate how these things were going to come at us. As well as this, some of the data, particularly some of the ONS data, a lot of the version control was being done on the documents that were being hosted on the website. So you might see a document called, let's say, ONS Care Home Deaths Week 26 version 1. Now, how are we going to predict what title, what version someone's going to call it when they publish it? And behind all of these things, it wouldn't have been so bad if we were being told about these. But almost all of these changes happen without any warning. Even pleads to these authorities, these organisations to let us know. It was very rare that we were actually given any advance warning. And so as a result of this, as I kind of said, some of these data items might have changed, some of the new data sources might have come in, and so we need to have rebuilds of those existing dashboards. Things we thought we'd already put to bed are we're having to relook at and redesign again. And as well, so there's all of these data formats, all of these data sources, sorry, but they're not always coming in the most logical data formats. So Excel, okay, yep, we can work with that, that's fine. But when people start sending you PDFs or Word documents as a way of sharing data, that's beset with its own challenges of how we can scrape the data from that. And so kind of all of those bits that I've talked about are kind of the unknowns, but there's also always going to be rolling along is the known changes. The requirements are going to change. So we have to find a way to deal with our requirements constantly evolving, as well as this backlog constantly changing the game. So that's kind of some of the challenges. So how did we go about the data collection process? Well, we used a combination of two tools really, Python and FME. So if you're not familiar with FME, it's a kind of low to no code data preparation environment, very similar to Alteryx, to Tableau Prep, to EasyMorph and a few other things. So we have an instance of that on, we have a server instance of that where we can schedule jobs to run on event-based schedules. And also we had Python scripts that were run from virtual machines. So wherever possible, we wanted to get a fully automated end-to-end solution. So something, for instance, would call an API or grab some data from a fixed URL on the internet, do some transformation and load it into SQL Server databases our side. Where this wasn't possible, where it was impossible, we kind of needed a little bit of a manual step in the middle. And so that might be where someone had to actually go in and manually save a document. They might drop that on a network drive, and we have scripts that poll these folders looking for updates. Again, load all of this data in, do some transformation, and post it all to SQL Server, internally hosted SQL Server databases. We could then build some Tableau dashboards, which were hooked up to those SQL Server databases, that would then sit on our internal instance of Tableau Server, and then refresh those extracts on a 2-hourly basis for this surveillance piece, I think it was, just to try and pick up whenever the data might change. So that's kind of a little bit around what we did, some of the challenges, the data that we needed and how we did it. So what was the actual end Tableau dashboard product? Well, so for the surveillance piece, this is just the surveillance piece I'm talking about. As I mentioned earlier, there were plenty of other projects which had its own suite of dashboards. Now, obviously, I can't show you the full internal one. This is a version that's hosted on Tableau Public, obviously all with just the publicly accessible data, but it kind of gives you a flavour of what it looks like. So our final product for the tactical dashboard, the tactical cell, was made up of 10 dashboards. One which gave an overview at national level, broken down by down to regional and upper tier local authority level. We also had a version which kind of gave a little bit more detail around the number of cases within each region, comparing UTLAs within those regions. We gave an overview of the position in Surrey, giving cases in the populations, a kind of more trends type data. We had one that looked at numbers of deaths within hospitals, the places of death, so whether, as I said earlier, whether they're in care homes or other community settings. We had an overview of shielded residents on this dashboard. As I said, shielded residents was its own project and had all of its own data and dashboard sitting behind it. But this one, because this was a surveillance piece, it kind of gave that overview. We had some information from Surrey Police that we were feeding into it around a number of crimes. They started using new codes for COVID-related crimes, so we were reporting on that, mostly just trend data for those. Looking at sudden deaths information, so comparing things like the number of deaths by suicide or drug overdose compared to the previous year to see if there was something, some public health message that needed to be focused on for our residents. And then finally, something just to kind of, drill home, like the social distancing messages and things like that. So that's a very kind of, very whistle-stop tour through some of the things that we've done. But so that I don't just completely bore you with spreadsheets, I thought I would do a live demonstration of one of those dashboards that you just saw in that video just then, to hopefully pick up some tips and tricks along the way. So, this is the dashboard that we're going to build out. We're going to build out a dashboard that gives an overview of the number of cases, broken down a couple of ways, by region and upper tier local authority. So the data sources that I'm using for this, I'm using the new relationship model in Tableau. I'm going to be using the public health data that gives the number of cases. I've joined onto that a shape file which will allow us to create some maps down to the upper tier local authority or county level. I've joined on some populations data. This is more just to show you how we're going to create some information around the rates. The data source, the public health data does now include rates data, but it didn't at the beginning. And so, so this is how we try to combat that. And then also a quick lookup table just to map those counties to the region so that we can do some filtering. So as I say, this is the dashboard that we're going to build. We're going to have a few headline figures at the top and then 3 charts down at the bottom. So the first one that I'm going to do is just the total number of cases. So I'm going to drag on the cumulative lab confirmed cases. Now I can see that there's 47 million there. That doesn't really sound right. That's because it's looking at all of them over time. So what we want is for the dashboard, whenever someone opens it, it filters it to the latest point in time. You can do that by dragging a date onto the filter, selecting individual dates and times, and then just ticking filter to latest date value when workbook is open. And so then it filters to the latest cumulative total. So I'm just going to format this a little bit differently. Let's make it match with the theme of the dashboard. Okay, and so there's our total cases. We can drag that on to our dashboard now. The next one that I'm going to do is the cases per 100,000. So as I say, we didn't have this in our data to begin with, so I need to create a calculated field to do this. So I'm going to call this cases per 100,000. Now, as is tradition on these things, my cat has just woken up, so hopefully I won't be interrupted. Cases per 100,000, and how I'm going to calculate this, I'm going to calculate the cumulative total. Now I have, in that populations file that I joined on, I have a field called all ages, which is the overall population. So I'm going to divide that by all ages and just multiply that by 100,000 to get the rates per 100,000. Drag that onto our text. Again, it's not going to look right, and that's because we haven't filtered to the latest date. We can do that again, and then just change the formatting again to bring it in line. Now this still doesn't look quite right, 273,000. And that's because we, on our dashboard, we're going to be filtering this on a local authority district level. So if I do this, pick the wrong one. If I filter by area name, and spell Surrey right. Oh, I think I've filtered on the wrong thing on the data source again. Bear with me one moment. Remove that and add another filter back in. So I'm filtering on the area type. I'm only looking at the upper tier local authority. Looked like I was looking at the lower tier local authority before. So, so that's why it looks a bit better. So if I drag area type onto here, and we area name onto here and filter to Surrey, then we can see that this looks more like the kind of rates type data that we'd expect to see. The final one of the top figures that I'm going to do is a percentage of cases within each upper tier local authority as a proportion of all of the cases in England. So how am I going to do this? I'm going to do this via the use of a fixed level of detail calculation in Tableau. So I'm just going to call this one percentage cases. And all I'm going to do is I'm going to divide the cumulative cases, the filterable value. I'm going to divide that by the fixed total of the cumulative cases. So we drag that on there. We can turn that into a percentage. Drag this onto here. Now it's going to show 100% to begin with. I'll just change the filtering on that to bring it in line. It's going to show 100% because we haven't filtered it. But again, if we filter by area name, let's just pick parking, we can see that that then shows the percentage overall. So let's drag these onto our dashboard. Okay, so we have our headline, our band figures at the top. But now we want to create a couple of charts down at the bottom. The first one that we're going to do is just a bar broken down by area. So I'm going to drag area name on and cumulative confirmed cases. Now, this looks a little bit busy, but we want to filter it by region. So remember I joined on that region lookup file, and that's enabling us to just filter this, make it a bit more manageable. But what we also want to do is make the filtered area stand out a little bit. And how are we going to do that? We're going to do that via a parameter. So I'm going to create a parameter from the area name. It's just going to input that with all of those values. And then I'm going to create a calculated field. Let's just call it color. And I'm going to say area name equals area name parameter. Well, that's going to give us a Boolean, so a true or false value, when the area name is the same as the one selected in the parameter. If I select one that's in the southeast, so let's just pick Kent, we can see that we then have a highlight there. Just going to change this. I want the highlight to be blue and the dull to be a kind of washed out grey. There we go. That stands out nicely for us. Okay, the next one that I'm going to create is a line chart. So if I drag specimen date onto the line chart, actually, let's make that and then drag the daily confirmed cases on. Okay, there's our line chart. But do we want the daily confirmed cases or the cumulative cases? Well, maybe we want both. Maybe we want the control to be on the user side. And so we can do this via the use of a button in Tableau, controlled via parameter action. So I've joined on a separate data source here. Very simple. It's just a spreadsheet with a single column and 2 values. I can then drag that value onto columns, change it to a shape. Let's just center that. Center that, and we want it to create a button that gives a pushed-in effect when that value is selected and a popped out when it isn't. And we're going to do that again via a parameter. So we just create another parameter from that. Let's just call this one shape and just say that if the shape, if the type, sorry, equals type parameter, then in, else, out. Okay, and let's drag that onto our shape field. And so now we can see we've got 2 different shapes. I'm just going to pick one that I made in Photoshop, but you can use virtually anything. You can use PowerPoint to make these kind of things. Make it a bit bigger. And so now this means we have a parameter which can control what type we want to see, whether we want daily or cumulative. And we can reference that in our line chart. So we can create a calculated field. Let's just call this custom value and say that if the type parameter equals daily, then return our daily field. Else if the type parameter, I can spell else, that might help. Else if the type parameter equals cumulative, then the cumulative value. And so now, rather than having to pick that, we can just drag this one field on here, look at our type parameter, change it, and we give that control in the hands of the end user. Finally, the last one that I want to build is a map. So with shapefiles, you get this handy geometry field, but if you double click on it, it imports the latitude and longitude and gives you a polygon. This is a polygon made up of lots of different shapes. We want to delimit that, so I'm going to drag the area name on, which will then allow us to select these individually. Just going to turn off all of these map layers. We just want it to be a chart type rather than an actual map for the time being. And I'm going to drag color back on here. Okay, so now we can see that's highlighted. Let's also filter region as well. Southeast. Okay, so now if we drag all of these onto our chart, we have our bar, we have our line, and let's pop our map on here as well. Just hide those titles. And finally, our custom value button. Just here. Immediately. Okay, so now all we want to do, I've realized we've got a minute left. I'm just going to very quickly show you some of the functionality needed to try and make this interactive. So to make this button work, we need to use a parameter action. So we can create a parameter action, which basically will just say, when on this sheet, whenever we want to affect the type parameter, whenever that value is clicked on, it's going to input that type into the parameter, and it's going to change that value. And now we can do exactly the same thing for the colors on the map and the bar chart, change those. So if we just select map and bar, and that parameter that we want to change is the area name, and we want to input it with that value, we can see that when we click this, it highlights those ones on the alternative. And finally, the last thing that we want to do is just build in a filter to filter those values at the top. So what we want it to filter, we want the bar or the map, and we want it to filter that total sheet, the percentage, and the cases per 100,000. We want it to be done on select, we want to leave the filter, and we want it to filter on area name. Okay, so now when we click these, we should see the values at the top changing. So there are a couple of other things that I want to go through, but I think I've run out of time now. But obviously, you can drop me a message if any of this was interesting to you. So I just wanted to finish up by saying thank you for listening to me. If you were interested in the dashboard and wanted to see more, there is a version available on Tableau Public, which you can go on to download on my profile there. But apart from that, I think we just wanted to say thank you. I don't know if we had any questions that we might have a couple of minutes to answer.
Hi, James. I think we've got a question from John, which is maybe worth a conversation outside.
Okay.
He's talking about problems he's had with some of the kind of polygons and spatial shapes when an area is wholly contained within another area.
Okay.
And kind of potential solutions we're looking at. I don't know whether that's one best to be taken outside.
Okay.
The user group.
That sounds a little
with you.
Specific, maybe. Yeah, absolutely. Drop me a message. So my emails. Hope you should have my email. But you can always reach out at any of these settings. My email's on the screen there. Just drop me a message, and I'll be happy to help.
So other than that, we don't have any other questions. I think people are still trying to catch up with what you've just gone through over the last 20 minutes. You make it look so easy. I've got one question though. I suppose I found it really, I mean, most of the challenges you described, I think every local authority in the country has experienced over the last 6 months and shared the pain in terms of trying to deal with some of these data sets. It's really interesting to hear you talk about the work you did on the data infrastructure and architecture side prior to Tableau. So how much of the overall work would you say sat in the kind of data prep engineering side, and then how much of it was kind of on the dashboard development side?
Okay, yeah, the majority. Yeah, so as is kind of the way with these things, kind of Tableau is very great, and it's kind of the cherry on the cake type of thing. But most of the work that you need to do to get it in the right format or make it, just basically make it Tableau-wise, requires quite a bit of prep, quite a bit of it might just be a case of pivoting data or something like that, but kind of some thought into all of the solutions to make that as easy as possible or as hands-off as possible. So yeah, time spent scripting, time spent managing and administering databases to try and do that was I'd probably say a good 70% of the time. And then obviously when they changed the structure of the data, we needed to then be on hand to change all of our scripts or our jobs to pick that up. We basically wanted the Tableau side to remain as fixed as possible, and us just to have to deal with the data structure changes as they came.
Brilliant. Okay. Yeah. So I think that's it in terms of questions. So I suppose just to kind of reiterate what James said, the contact details are on screen. If I was just checking, James, I think the last virtual user group we did was July 2019.
Okay.
So yeah, a while ago. So yeah, we're looking at running events on a more frequent basis going forwards. So please, reach out to me or James if you'd be interested in sharing your story at any future events. I hope you enjoyed the session, and hopefully we'll see you all again soon. So thank you very much and goodbye.
Fantastic. Thank you, everyone. And thanks to our speakers again.